Right. Well, I want to welcome everyone to what's now our fifth Community Engagement Forum. We launched these a year ago, and it's been a great run. We've had great participation from all over campus, and we've gotten great feedback on the presentations and discussions. Um, just a reminder, there'll be another one of those surveys coming out, evaluations after this. We do pay attention to your comments and feedback, so please take the time to let us know how this went for you. So for today, we're going to be featuring students who've been involved in community engagement. This is going to be kicked off and mostly moderated by Janet Meredith. Janet is one of the first people I think I met when I came to campus now about 9 years ago. At that time, Janet was the executive director of 2040 Partners for Health, which is a community-based organization that serves communities around our campus and also in Denver. Janet's now with our department and directs our community engagement MSA programs and has worked with just many students over the years. And we're very fortunate today to have some of those students with us who will be telling the stories of how this has influenced their education and their career. And without further ado, I'm going to pass the mic over to Janet to get us started.
Thank you so much, Dawn. And it's wonderful to be here. Nothing makes me happier than sort of hearing from the students about their projects. So this is fun for me too. As a tiny bit of background, about 10 and a half years ago when I was working at 2040 Partners for Health, I was approached by two medical students who asked me if I could help to connect them to community members. They wanted to do something to address health disparities and disparities in health outcomes. And two of the original small group of students that I worked with then are on this call today. They're now both family doctors, and it'll be really fun to have that longer perspective as well as that of students who are currently still involved. The initial project was called C-STAR, and you'll hear more about that, but it led to more projects and more students who are also focused on working with communities, all of them using CBPR methodology. So there are currently 8 projects, and each year there are about 75 to 80 students who are actively participating. Each project recruits new students every year. The majority of the students are active through their 4 years of medical school, but we also have physical therapy, nursing, public health, and pre-health students involved working alongside them. My role is to direct the program. I also mentor the projects and the individual students. I try to connect them with communities that they want to partner with, faculty, resources, and I support their funding efforts, do training, and I also I'm actually present at almost all of the community and student meetings. And part of the reason for that is that I have a bit of a glue function here, which is, of course, there is annual turnover in students. And so I can provide some longitudinal connection for the community members as well as for new students. So what's been so interesting to watch is how the projects not only do valuable and important work, but that the process of working closely with community members has a very significant impact on students themselves. And that's what we're here to talk about today. I've asked the presenters to put up a single slide so you see who they are and what they're doing right now and what project they've been in, but not really to spend their time discussing the project in depth. Rather, we want to focus on the impact that being involved has had on them. And what we asked each student to do was to address, in whatever way they felt captured the most important impacts, 4 possible areas. One is learning. What are the important things that you've learned professionally or personally, and how did this add to your medical education? Impact on them personally, so what affected them? Did it affect their professional identity, influence what they wanted to do in practice, and has there been a lasting impact? Community insights, so what did you observe, see, understand? How have the relationships with community members influenced and taught you? And then we just said something else. If there are any other key takeaways that we didn't cover, that they should feel free to bring it up. So I'm not going to ask them questions. We're just going to go from one student to the next and let them talk to you about what they do. And the first student we're going to start with is Katie Habernach. And as Kaylee pulls up that slide, Katie will introduce herself to you.
Hi, I am Katie Habernach. I am an MS4, and I work with Iraqi refugees and migrant communities. Very briefly, our project is kind of a two-pronged approach. We offer direct community service with the help of the family medicine residents who provide basically seminars and some doc-in-the-box sessions with our community members. And then the other prong of the project is to do a qualitative research study to better understand barriers to medication adherence, as well as to further characterize and better understand the distrust or dislike of the United States medical healthcare system. But to talk, as Janet said, to talk more about what I've learned from the project, I think the first and most important thing I learned from doing community work is it expanded my understanding of where and how we should be delivering healthcare. Particularly in this community, there's a lot of distrust in the US healthcare system, in the US government. How does the US government and the US healthcare system interact and work together? How does that impact their visa status or their family members' visa status? So I saw that there was a lot more comfort in interacting with physicians in a community center where they felt safe. And there's just all of these ecosystems that exist outside of the healthcare system that I think are not utilized, and people feel more comfortable there than they feel necessarily in a hospital or a clinic. The second thing I learned, probably this is my personal or career development, was how important building trust with communities is, and doing this through longevity of relationships, consistency of relationships. Oftentimes, I would think that I was going frequently to the center and going to visit with them, but if I was gone for 2 or 3 weeks, every time I would go back, they would ask where was I and where had I been. So it's really important to be there. So if it's something that I'm going to pursue professionally, which I'm hoping that it will be important to establish with one community and be consistent with that community throughout, especially when you're working with communities that have a long history of trauma, as this community does. And so to really address that trauma, you need to establish trust and work with multidisciplinary teams. And then I think the third thing that I learned, and initially I was thinking that this was a way to better care for this specific community, but I think it will just impact the way that I'm going to be a doctor in the future. We were recently on a meeting with a community leader who was explaining to us that in Arab cultures, physicians are seen really as healers. And so there's this deep kind of personal connection that you feel with your physician that's really missing from the US healthcare system. So I think it's made me think more deeply about, when I am interacting with patients, making sure to not be looking at the computer, to make sure to do a physical exam, even if I don't necessarily need a physical exam at that appointment. And in what ways can I make people feel that I genuinely care about their health and them personally, which is really important to this community in particular, but it's really important, I think, for all patients, and has just changed the way that I view how I'm going to be a clinician. And yes, so overall, I'm very thankful for this experience. I've gained a lot from it, and thank you very much to Janet for mentoring me for all of these years.
Thank you so much, Katie. We are going to switch now to Ben, who will talk about his project, or his experience on his project. And I'll turn it over to you.
All right. Thanks, Janet. So first of all, thanks so much for allowing me to, share my experiences today. My name's Ben Fuller. I'm also an MS4. Had the opportunity to work as one of the many partners on this project. Um, and as you can see, our project's called the Youth Community Health Awareness Partnership, or YCHAP for short. It's essentially a community-based participatory research initiative that is addressing alcohol use in the refugee population from Burma, specifically in the Aurora area. We've partnered directly with community members from Burma, uh, along with fellow CU Med students. Our aims of the project, just in brief, were to work with the community to identify a health issue that's important to them. So they were on the ground level helping us through focus groups and other things to identify this issue as important to them. And then we gathered qualitative data through one-on-one interviews. And then eventually we'd like to generate a culturally appropriate intervention if they desire that. And as far as my personal experiences, beyond all the data, the qualitative, quantitative, and possible interventions of the project is working in partnership with the community over the past few years has really impacted me dramatically, personally and professionally. Professionally, it's really allowed me to better glimpse the health disparities and health inequities that we are taught in the classroom, and kind of being able to put a face on that. It's definitely had more of an impact on me being able to know these people personally and them sharing their experiences with me. It's really inspired me as a future physician to be an advocate for patients both inside and outside the clinic walls. I think that's something that we'll see in the next 10 to 20 years, is that physicians are really going to need to step up and start to advocate socially outside of just the clinic. So that's something that's really affected me and what I aspire to be. Personally, the partnership it's really just brought me a lot of joy. Connecting with the community beyond the posters and publications and everything. It's that connection that really matters most to me, and developing those relationships across these perceived boundaries. And I'll just echo what Katie said as well, is that building trust with these communities is incredibly important. It's not enough just to build the bridge. You have to maintain it as well, and that's been a little difficult with so much turnover. But I think I've attempted to maintain those relationships throughout the last 3 or 4 years that I've been involved with the project, and hope to maintain those moving forward. Overall, this opportunity is just one of the amazing highlights of my medical school career. And really that's thanks to, my incredibly supportive mentor, Janet Meredith, and fellow researchers, and most importantly, the community members and community partners. They've really stepped up and helped us in many different ways, and really for making all of this possible.
Thank you so much, Ben. That's great. That idea of the community sort of being some of your faculty, in essence, is really powerful. I think both you and Katie have touched on that. I would like to see if Amelia could jump in next.
Absolutely. Thanks, Janet.
Okay.
All right. So my name's Amelia Davis, and I'm a current MD and PhD student at the University of Colorado. I'm the current director of CSTAR, which stands for Community and Students Together Against Healthcare Racism. Mike and Nikki, who are not on this call, are two of my peers who are also leading CSTAR with me. Over the next few minutes, I'll try to summarize quickly what CSTAR does, and also share a little bit about my experience. So as you'll see on the slide, CSTAR is a coalition of local community members from the Denver and Aurora area, health professions and pre-health students, faculty members, and medical residents, mainly from the internal medicine residency and the family medicine residency at CU. So C-STAR was established with the vision of students and community collaborating to better understand perceived discrimination and then design feasible interventions to equip future healthcare providers and community members to reduce the effects of implicit bias. So C-STAR was founded in 2010, and we're going to hear from some of the founding members shortly. And it was founded in partnership with community members to specifically address racism in healthcare. C-STAR is very much grounded in the CVPR process, and we have seen that since its founding. At the very beginning, there were focus groups with the community members to identify the key elements of perceived discrimination. And the three key areas that were agreed upon to sort of address as we move forward as a group were to combat provider biases or assumptions, address the lack of trust in the healthcare system, and then also address institutional racism, both historical and current. Since then, we've continued to engage our community members in every step of the process through CVPR. So even though C-STAR and all of us can acknowledge that there are many factors than the ones that I just mentioned that contribute to systemic racism, we sort of honed in on specific projects around the topics that I just mentioned. So we have projects in working with curriculum reform at the University of Colorado School of Medicine. We have a youth mentorship program to encourage engagement and interest in healthcare professions and youth from historically marginalized groups. And then we also have a community empowerment project in the works in healthcare settings. We've also collaborated with other student groups and other organizations. So we have recently begun collaborating with SNOCAP to create, distribute, and evaluate results of patient and provider surveys to better understand experiences of bias and discrimination during clinical experiences. And then finally, in partnership with the Department of Family Medicine, we have a lecture series that will be starting this year that will be honing in on health disparities topics in memory of one of our founding members, Greg White. So to get into the impact that C-STAR has had on me, I would say that C-STAR has had an immensely positive impact on my medical school experience, and I would say it has absolutely been a highlight. I remember walking into my first community meeting as a first-year medical student, and I thought right away, these are my people. I just could get a sense right away of the relationships and the trust that has been built over time with one another. And from my perspective, it's a group that is truly genuine, warm, and caring. And this is even while we're talking about topics that can be very complex and challenging to address. In the past, we've had holiday parties together, and we've been able to support one another through very difficult life events, both personally and professionally. As Ben and Katie mentioned, I think one of my biggest takeaways is taking the time to build trust with communities and maintain that trust. I've heard time and time again from our community members that they have mistrust in our medical system after historical medical discrimination and mistreatment against their communities. So I feel that this space recognizes their experiences and provides a way for their voices to be truly heard, and then also to find ways to move forward. And finally, what I've most appreciated is the vulnerability and openness of our community members and sharing their experiences both in life and in healthcare. And as I look forward towards my career in medicine, I feel that my experience with C-STAR has only reinforced my commitment and passion for truly engaging with the communities I serve.
Thank you so much. That is fantastic. I think I'll move to Bella next. If you could jump in, Bella.
There we go. Can you hear me okay?
And Bella is one of those two students who are the very, very first to ever approach me. None of this would actually exist without Bella. So I just need to give her credit for that.
it was a little crazy to hear that that was 10 years ago, Janet, when you were introducing this. But time is flying. So yes, I'm Bella. I am one of the students that first walked up to Janet, and she is, I don't think there's ever any way to summarize what Janet does. So just, I think a huge reason of success for any of these projects is strong mentorship. And she has been my mentor through med school, but has continued to be there throughout. And I think this is a part of what is the most meaningful for me is relationships. So just some background though, I am, so I graduated from CU School of Medicine. I trained at Tacoma Family Medicine for residency for family medicine, and I practiced out at Salud in Fort Morgan for a couple of years, and now I'm working at Clinica Family Health in Thornton. And so C-STAR, I feel like, is a part of defining who I am. It's, I think about it often. 10 years, when I think about that, that's kind of wild, 10 years later, but the relationships, I think, are the biggest piece of that. And so I think, sadly, you know, a lot of us go into medicine, especially family medicine, underserved medicine, to help our communities, but our communities are very segregated. So I have stories myself of bad experiences with healthcare, discrimination, but it was not Black stories. It's not Latinx stories. It wasn't in the Aurora area. And it's in medicine too. And as I look back on it, I'm so grateful for C-STAR as an opportunity to build relationships in a place that was outside medicine, outside the clinic, where there is inherently power dynamics at play, where I really could genuinely be the student, get to know people. There's not a checklist of quality measures I need to get through, but really just understanding people and getting to meet people that I wouldn't have met otherwise. Amelia mentioned the Greg White series, and he was my buddy when we first started communicating. We had a big group and we just wanted to make sure everybody knew about meetings and updates, and so he was assigned to me, but our friendship went far beyond that. We would get together when I was in residency, and I still miss him all the time. I think the inequality in our healthcare system, you know, it's just deeply internalized it. I think a lot of people from across projects talk about the trauma, and I've continued to see it in different ways, like the trauma and mistrust of healthcare from being in a rural setting, from being a refugee, from being Black. And so just spending that time in those relationships, I think, is so much more powerful than learning about it in a lecture here or there, especially when you love the people that are telling you these stories. I think it's helped for me as a provider. I think it is also, I think there's healing in relationships, but relationships really do need to be equal and founded on mutual respect. And sometimes healthcare is a broken system itself. It doesn't allow for that. So C-STAR was a great place for that. And it brings me healing and joy because I think it has made me feel less segregated from all the communities I've worked moving forward. I think just understanding and deeply internalizing what mistrust there is, what trauma there is, it makes it less personal, and I can just acknowledge and listen better. I think I work at a community health clinic, so there is a lot of tasking. And so, for example, one of the things we're working on now is like going through diagnostics that are not resulted, but this is on top of like furloughed medical record staff. This is on top of decreased charting time. Like, we have a ton of work to do and given more work, but it just feels more personal because I've lost a friend who was lost to follow-up based on a lab result. And so, not that I'm as efficient as I'd like to be, but it definitely causes less burnout for me because these are my people. It's no longer like communities and me. I mean, there still is, but it feels less so that way. And a huge part of that is thanks to C-STAR. I think too, in terms of what community work does for students in general, is so important because of this history of institutionalized racism and bias, not just in medicine, but in research. where I think we have a long ways to go, but asking the questions of what actually makes people better providers, happier providers, do better for Black, Latinx patients, for for me, for C-STAR, that's close to my heart, is worth investing in and continuing to provide resources for, because I think, for me, I think internalizing this deep love of Black and Latinx people is going to make me a better doctor than a lot of lectures or anything could come close to doing for me as a provider. Thanks.
Thank you so much, Bella. It's really amazing to think how that project is still so active and doing so many things, and you kicked it off. I am now going to switch to Catherine Collada, who worked with another project. She was also involved in founding another project. And so we will switch to her slide and let Catherine speak next. Yeah, there you go.
Perfect.
Hi.
Hello. Hi, everyone. Thank you, Janet, so much for the introduction and for being willing to slide me in as the clinic schedule allows. My name is Catherine Collada, and I'm one of the pediatric interns here at Children's. And I did med school at CU and just graduated this spring. I am going to talk a little bit about addressing infant and maternal mortality, which is a project that is very near and dear to my heart. It's actually a very timely topic as well, in that we've known for many years that babies born to Black women tend to die at a much higher rate than babies born to women of any other race. We also know that the maternal mortality rate is particularly high among Black women. And this is not just a national trend. This is local, this is here. And while Colorado in general meets kind of what is thought to be like the global goal for infant mortality, we have a huge disparity in that Black infants are more likely to die at about twice the rate. It used to be in 2015, 3 times the rate as babies of other races. And we know that this persists across socioeconomic status and education level. And I actually just yesterday learned of a pediatric chief resident from another institution who died shortly after childbirth and is a Black woman. And that just happened this past weekend. So it is here in our medical community, it is here in our Denver Aurora community, and something that is, I think, a really important topic. And a lot of the data when we started looking into this was based on statistics and kind of the hard things that you could gather, the pieces of quantitative data. And what I think is even more important than the numbers is the people behind the numbers. And so something that we've sought to do was to talk to our community members, hear about their experiences with giving birth and being a mom as a woman of color in our community. And I feel like this has been the single most defining piece of my medical school experience. I am so grateful to work with Janet and with our community members. They have taught me so much in terms of experiences with healthcare providers. They have, through their stories and their experiences, modeled to me and informed me of the type of doctor that I want to be. And this is something that I don't think I could have read in a book. It's been challenging at times, and talking about uncomfortable topics, talking through mistakes and kind of persevering and figuring out, okay, this is important. We have a common goal. Now, how are we going to work together? And when do we need to change what we're doing? And so I think that the different skills that I've learned in this process are going to help make me a better doctor. And even more than that, like the relationships and the stories of our community members help me become the doctor that I hope to be. And so that is a little bit about the Infant Mortality and Maternal Mortality Project. Through that, we've done focus groups and had several different initiatives to help support Black women and their children in our community, and really to let their voices and their stories and their strength shine, because they have the wisdom and are stuck in a system that historically and personally has not led to good outcomes for them.
Thank you so much, Catherine. We have one more presenter, and then I'm going to show a little bit of data from sort of 8 years of quality improvement surveys. But then you'll have a question, all of you will have time to ask questions of these students. So stick with us. And now I'm going to turn it over to Clint McBride, who, along with Bella, was one of that first group of C-STAR students 10 and a bit years ago. There you go. Clint,
can you hear me now?
Yes.
Hi, I'm Clint McBride, and sorry I was late. I just finished up with clinic. That's me in the back as part of C-STAR, which was just a life-changing positive experience for me. I had gone to undergrad in CU Boulder after growing up in Fort Collins. So both places with an extreme lack of diversity. And then I went and I taught high school in Richmond, California, where I had very few white students and a predominance of African American and Latina students. And so that was kind of a culture shock. And in Boulder, I had taken some really great classes about community development and CVPR, specifically sort of geared towards developing communities. And so I sort of had this textbook idea that it was a really good thing to do, to listen to patients and community members and gather their stories. But I hadn't really experienced it. And I just think in medicine, there's so many things where the textbook tells you one thing, and then you experience it in the real world, and you kind of learn what to take with a grain of salt and what really is truth. And my experience with C-STAR was building these relationships with community members who were diverse and had lived just experiences that were completely different from my own, even though they grew up maybe an hour from where I was, or lived maybe an hour from where I was. They were living in a completely different reality that I had no point of reference for. And for me, the C-STAR experience was one of learning how important that wisdom is. And if I could sum it up in one sentence, it's just believe your patients, no matter what they say. Believe them. And when that thought first occurred to me, it was not profound. But as I have progressed through medical school, residency, and now becoming an attending physician and faculty member at the family medicine residency in Fort Collins, it's just amazing how often we forget that simple truth of, like, your patients are telling you the truth. don't doubt what they say, don't discount what they say, don't say, but there was some cocaine on a urine drug screen, so everything they say is bullshit. It's not. And if you really take the time to listen to your patients and get to know them, you will make great medical diagnoses, and you will refer to the correct specialists, and you will look like you remember all the pathophys and biochem from medical school that I have long since forgotten, but can look up when I need to. So yeah, C-STAR has totally changed my life. There is not a day that goes by in my clinical life where a lesson from C-STAR doesn't come back and make me a better doctor. So I just couldn't be more excited that that the work continues, and so many of you are carrying the torch and able to learn from a wise sage mentor like Janet, and the wise learned experience of our community members. Just what a cool thing.
Thank you so much, Clint. It's I think all of us who've been involved, and you see community members and students in this picture and in so many of the other photos that we've already seen. I mean, I think all of us just feel like we had this just God-given opportunity to understand things that were new to us, and to have people sort of tolerate our lack of knowledge and teach us. And so, like you, I feel incredibly grateful for the experience. I wanted to show a couple of findings from, so every year as students graduated, I've done a survey, which really was for quality improvement, to say, is this helping? Is this worthwhile for you? What can we do better? And so there are just a few themes that I pulled forward here, just asking people if being part of a community-based project through medical school, for instance, was an important part of their medical or health education, or offered experiences unique from other curriculum, or gave them valuable experiences working with community. And these numbers here are the ones that there were 4s or 5s on a 5-point scale, and most of them were 5s. I mean, I think this is a real testament to the fact that students put so much into this that they got a huge amount out of it, and that community members were so committed to these partnerships because of the trust that was built between them and the students, that they gave so much to it as well. So, I think that these scores show the kind of value that these partnerships can bring. I was also interested in asking people whether they felt the experience was likely to influence them in their career, whether as a provider, researcher, or educator, and most said yes. And I think hearing from some of the students, or some of the former students who are now doctors or residents, it's really rewarding and wonderful to see that these lessons carry forward and influence them every day. And the other was just a kind of weird blanket question that said, did this experience change or affect you? And then there are a whole lot of comments about that. But 92% said, yes, this changed me, this affected me. I'm not going to go through everything that's on the next 2 slides, but I pulled some quotes just from random, from these surveys throughout the years that you can read. But it was fascinating to me because I didn't expect this. I didn't have much knowledge of medical school curriculum or experience prior to starting work with these students 10 years ago. To hear them say things like, there was no other single experience that will have as profound an impact on my clinical interactions with patients. And those are, again, former students who are now doctors. The other thing that I think people said over and over was that it regrounded them in their values. The ability to meet regularly with community members sort of brought them back down to the ground And even though all of the lectures and the other experience was useful, this was something that grounded them in why they went to medical school to start with. So there's another slide. One has a very long quote, but I think it's a really interesting one, the last one, that covers, I think, the range of what we've heard today. It's about friendships with other students and community members, grounding them, having the opportunity to learn how to communicate and talk to patients, especially people who are different than your own lived experience. So there's just a whole lot of feedback here, and you're welcome to, I'm sure, you access these slides and look at this more, but it's interesting to see the degree to which the impact of doing this work is, I think, beyond what the projects themselves are set out to accomplish, and relate to the kinds of providers that the students are going to turn into. So, I mean, that's what makes it so motivating for me, along with the fact that it's incredible to get to work alongside community members and students who are partnering together on these topics that are of importance to the communities. So with that, yeah, I think it would be great if people just wanted to ask questions of the students, or whatever comes up.
Janet, there's a question that got put in the Q&A about the service learning curriculum within the School of Medicine, and are there key insights that could be shared from these programs?
Yes, and I have had the opportunity to work on, so 2 years ago we formulated a community engagement curriculum advisory board, so bringing community members to advise on the curriculum reform. And the area of our immediate focus was service learning. So we have heard some input there. I mean, I think there's still always more. We're also hopeful, well, it sounds like this program will continue with the new service learning, and there will still be opportunities for students who choose to do this kind of project rather than to follow, I guess, there's going to be a structured service learning opportunity, but students can also do their service learning this way through a project like this and get the other curriculum benefits along with it. So this will keep going. But yes, I think that there's lots for them to learn from what these students have experienced.
Well, I'm going to take privilege of the moderator's chair and ask our panelists. So what would you say to a first-year medical student who's thinking about jumping into this, looking at all the other stuff that they have to do in medical school, and how they could fit this in, and whether or not they should?
I'll jump in. To answer the last question in one word, yes, whether or not you should. Absolutely. I think that working with community members is, I think, the most valuable thing in shaping what kind of doctor one can become. We are fortunate to live in an age where knowledge is at our fingertips. We have great resources that we can look so many facts up in, and truly, I think the experiences that I think drew us to medicine in the first place are found within our patients. And also the experiences that bring the most joy in life. And med school can be hard and very focused on tests and books and learning a lot of information, which is so important. But then really, I think being able to work with community members and find joy in that is equally as important and makes this work sustainable and fulfilling. So yes, I would 100% recommend it.
I totally agree, with one caveat, which is, if you are going into medicine just to make money and not work with people, and your goal is a non-patient facing specialty that does not interact with patients, consider radiology or pathology. No disrespect to radiologists or pathologists here, or future radiologists or pathologists. But if that's really what you're in it for, then don't do this work. But to everybody else who's going to work with patients, and to the radiologists and pathologists who want to delve into getting to know the patients and the world better, then absolutely, just like you said, this will be more important than any of the other stuff. And in the long run, complement it, and if you're gonna flunk out and you really have no other choice but to do nothing but the academics, then that might be the one other time, where this is an enriching thing. But yeah, if you can add one more thing to your list, even if your academics take a hit, in the long run of your career, pouring your heart and soul into a project like this will do nothing but pay that dividends.
Oh, go ahead, Amelia.
Sorry, Katie. I just wanted to jump in and kind of echo what both Catherine and Clint have mentioned. My resounding answer to Dawn's question is yes, first year student should join. And actually my two co-leaders and I are in the middle of trying to gauge interest in first year medical students and get to know them a little bit more. And it really does have to be a good match of, is this something you're interested in? We don't want you to feel even more drained than you already are or are going to be throughout this medical school experience, because it is a challenging time. I think one thing that I've kind of reflected on over 4 years is sort of how do we stay grounded in humanism throughout our medical school education. And I don't think it gets lost completely in studying through the books and the texts, but I think there's such a pressure and high demand on students to learn so much information that I've had discussions with people both inside and outside of medicine about burnout already in medical students. So I would say that community engagement sort of makes me think a lot about humanism and how do I connect with people and patients even during a very challenging time where there's a lot of demands.
Can I piggyback off of what Amelia said in terms of it? Because I definitely think that it's extremely important, because if someone doesn't want to be there, there is damage that can be done too, right? Do no harm. And so if you want, there was a question in the chat earlier about being researched on, and I think the whole goal of CBPR is to partner with and research together, bring tools of a university to communities. CU came into Aurora, right? Bring it to the people, our communities. And so if someone doesn't want that, then it could perpetuate those feelings of mistrust and hurt. So I definitely think there's a fine balance to be had about what is a good match and what people's hope is for these projects. I think everybody could benefit from it, but I also think that there's room for harm. So I think thinking of that too in terms of there's different identities that are coming in to medical school, and so being aware that these can be at play. If someone you know, it shouldn't be in place of academics. Part of it is you need to provide excellent care to all communities, and that's a certain level of medical care, you know, and so it can look different for different people. Just having more underrepresented people in medicine can be important, but sometimes people, you know, it can, how to get through it and how to become a physician can look different for different people. So I just think that there's a lot of complexity to it, and it has, like Amelia said, it depends on it being a good fit. Is it re-energizing? I think the book learning is one of the things that we reference, and it's not that book learning is bad, but like one of the things is book learning has systemic racism embedded into it, and so it was a nice reminder to be like, question this, you know, like what, you know, how to stay true to myself and who I am and my people through this meeting every month. You know, I remember when I was a med student is when Trayvon Martin was shot, and we were sitting here talking about racism in medicine, and we just had to stop our project and talk about it and be like, yeah, I'm hurting. You know, like, how am I supposed to keep functioning? Like, oh yeah, but by the way, test on this day, and like aims of the project and whatever. And so like, that's still true to this day, you know, like I'm like, I kind of call out sad, but knowing that our patients are doing that too, and our students are doing that too, and knowing that different students may be in different places with this, it gets complicated. So I think it was 100% a blessing for me, but definitely should not be mandated because I worry about the damage that could do, in my opinion.
Katie, do you still have a comment?
I would echo what everybody else just said. And I guess I would also add that I think that a lot of the experiences that I had left me with more questions than answers. And I think it was important to get a running head start for a couple of years to learn how to think about how to do this work well, and how to better serve communities, because it's really challenging. It is really fulfilling, but it can also be really challenging. So I feel like I got extra mentorship, extra support, and you know, my project had a lot of hurdles, and it was really nice to learn how to overcome those hurdles in a safe learning environment as well. And I think that if I had just started trying to do this work as a resident or a physician, I'm not sure I would have known how to seek out help at appropriate moments or ask the appropriate people for help. So I think that it's just as much, and in my opinion, I mean, you can diagnose appropriately, you can prescribe the appropriate medication, but if you can't get people to trust you, and if you can't, if people don't want to take the medicine, then it's kind of a waste of time for everybody. So I think that it's just as an important part of healthcare delivery, just as much as what we learn in the books about diagnosing and prescribing, is developing these relationships. And I think that communities impact healthcare a lot more than I think I theoretically understood that they did, but now that I've experienced it and see how information travels within communities and how decisions get made within communities, I think I have a much deeper understanding of how important that is for healthcare delivery.
Ben, did you have anything you wanted to add?
I think that was all amazing. I totally agree. I think, you know, I think that it was, for me personally, it really grounded me. And as Amelia said, kind of brings you back to that humanism of why a lot of us got involved in medicine to begin with, especially during those first 2 years. It can be quite difficult to see that light at the end of the tunnel. And I just remembering meeting with my group members, meeting with members of the community, kind of, you know, re-sparking that fire in me through those years where it's tough to see, you know, how all this adds up. I'd also echo, and I think it's a great point, that, you know, it has to be a good fit too, and harm can be done. I think we have to acknowledge that you have to be all in on this. It's not about, you know, it's not the same as bench research or anything like that, where you're pipetting or you could do an experiment in a few months. You have to maintain these relationships, and it's not just something that's on paper. It's affecting communities and people in their everyday lives, and I think we have to keep that in mind.
I just add one thing, and you know, out of, I think about 150 students have been involved in these projects so far, and I think we've only once actually quietly asked a student to step back, and it was a really interesting issue, very sort of uncomfortable, because of course we tried for a long time, the leadership of the project, and I helped, but really the leadership of the project did a brilliant job trying to bring that student along so that they could see how not to do any harm. But in the end, the person just couldn't speak respectfully to community members. It was as if there was a disconnect, and I don't know what caused it, and I can't really speculate, but they could not just speak respectfully and listen to community. They only wanted to listen to professionals. And so, at that point, there would have been harm. And so eventually we just said to the person, I think you just need to step away and find something else to do, because it was more important for us to keep from getting holes in our boat with our community members and have them feel like we were letting this become a disrespectful situation than to include that one person.
And I just want to kind of add, my first comment was about the people that maybe shouldn't do this, and we've talked about these harms that we have to be mindful about so that we don't do them. And it just made me reflect that this project and these projects and this process of CPR, when it's done well, as it is in the hands of Janet and the community members with continuity, it is therapeutic. It's a therapeutic process. There are pathologies of power, to quote a Paul Farmer book, and there are sicknesses and illnesses in our society and our economic system and our medical education system, and projects like this heal and improve, and they really are therapeutic. And the benefits are huge and multi-level and bigger than the kind of benefits that you can get with one patient at a time, and so complementary.
Well, thanks you all. I'm speechless. Just the power of relationships, the power of partnering with communities. Thank you all for the work that you are doing, that I know you will continue to do. Thank you, Janet, for your ongoing work with our students. We're unfortunately at the end of our time. We could go on for a lot longer, I'm sure. Thanks everybody for attending. Again, thanks to our panelists, and we do this every 3 months. So please come back, and we'll see you all in January.